welcome to The Acorn, the podcast that drops a little bit of psychoeducation so you can gain a better understanding of the therapy world and yourself. So without further ado, let's jump into our episode. Hello and welcome to Season 1, Episode 15 of The Acorn. Today we're going to be exploring what is brainspotting. Well, brainspotting, or BSP, is a type of therapy developed by Dr. David Grand. And this uses different eye positions, or quote-unquote brain spots, to help clients process trauma or distressing emotions. In brainspotting, where you look affects how you feel. And that's a direct quote from Dr. David Grand. The idea here is that unresolved trauma in the subcortical brain can be processed by gazing at certain spots in your visual field. To find the brain spots which hold the traumatic experiences, the therapist moves a pointer across the client's field of vision while watching for any specific responses. Then, the client can listen to a bilateral stimulation audio track while processing the activating memory or body sensation. So you may be wondering, what can brain spotting help with? Well, brain spotting can help people expand their window of tolerance, and it can help them to move from a place of hyperarousal or sympathetic state. It can help people move from a place of fight or flight, a place of anxiety, panic, overwhelm, anger, or even hypervigilance. Brain spotting can also help people move from a place of hypoarousal or a dorsal vagal state of freeze, immobilization, low energy, depression, numbness, shutdown, collapse, feelings of hopelessness, despair, dissociation, and disconnection. Like EMDR, brain spotting or BSP therapy can be used for things like attachment trauma, PTSD, betrayal trauma, anxiety, depression, grief and loss, limiting beliefs, negative self-assessment, expanding positive cognitions, and even things like performance enhancement within coaching and within sports. Well, that was some basic information about brain spotting. So now as we close out this episode, remember to take a moment in your day to remind yourself to pause, breathe, hope, and heal. Take care. Well, this has been another episode of The Acorn. Remember, the content in these podcast episodes are for educational, informational, and entertainment purposes only. Disclaimer. Anything said in this podcast should not be considered as treatment, professional consultation, advice, clinical instruction or assessment, or any other mental health replacement. Listening to this podcast does not create a therapist-client relationship between you and the podcast host. Always seek the advice of your own mental health provider regarding any questions or concerns you may have about your mental health needs. Also, if you need immediate help, contact your mental health provider or call 911.